the office?
I have a lot of back pain, and I feel like my posture is very off.
Okay.
The top of my back is like really tense.
When did this all start?
I noticed it like a year ago,
Okay.
but like it wasn't a common thing. Like not everybody felt that way, I guess.
So the shoulders are tight, shoulders are tense. That's number one reason.
Yeah, and my posture is like off. I've known that, but it's like hard for me to like stand up straight.
Okay, so do you feel like you're slouching in a forward position?
Kind of, yeah.
Okay, and what else?
And I have a lot of knots. Does that have anything to do with it?
Okay, we'll talk about that. So the knots started after you were feeling the posture. It's kind of all happening together.
All kind of happening together, yeah.
Okay.
Just things I noticed over time.
What else?
And I just have like, my knee tends to crack a lot, like if I'm working out.
Left knee, right knee?
Left.
Left knee. When you're working out, doing what specifically? Going upstairs, downstairs, squats, leg extensions?
Laying and then like lifting or like bringing my knees like up and down, like this or outwards. And
Okay,
inwards.
you're flat on your back on a mat or something, and you're doing some leg exercises?
Yeah, and then I'm bringing them up.
Without weights?
Yeah, without weights.
Okay.
Just like,
all right, left more, the right also, or just the left?
it's just the left.
Okay, and left what about in the low back? Low back, anything in the low back, pelvis?
Not too much pain there.
Okay.
I feel like it's mostly just like neck, shoulders, and if I go like stretch out this way, like this always cracks. Like,
The upper?
Yeah, for some
Okay.
reason, I don't know.
And let's go ahead and I just want to feel kind of what's going on first. So posture-wise, we want actually a little more curve in her spine here, this way, okay? Does that make sense? This way. Now, as you're sitting there, we see a couple of things we see. Right shoulder is slightly higher. It wings out a little bit more than the left side. Right shoulder is higher on this side compared to this. If we come from the back here, let's look at the ears. We can see left side is slightly higher and gone forward, okay? All right, so we're dealing with mainly posture and knots in the upper back, and we call it crepitus or crackling in the left knee. So the first thing we're seeing is what? As we're running the meter on the spine, and if you just look at the meter up top, we see we got a lot of pressure here at the atlas C1, about 20 points on that left side. Okay, that's the first thing. Okay, as we run it down, T4, T5 on the left side. And going down, we have not a lot of action here on the base. Most of this is going to be coming from her pelvis on that left side. And that's part of the kinetic chain, right? Pelvis, hip, knee. And I'll explain that in more detail when we continue. So I got about a 5-pointer here, 5 here. The majority of it is in her upper cervical. These are the breaks that I got here, up here, here, and here. Sacrum, around T4, T5, left atlas, okay? And as we're running it, you can see starting here, those are the tissue changes, right there. So if I palpate in here, tender in there, more tender at the bottom here or the top here?
Bottom.
Okay, this one, how about that one?
That's tender too.
Okay, how about that one?
Not
as bad. That's a little, but more so here. One more time, here or here?
Down.
Down?
Right
Okay,
there.
right there. Head down, please. Let's count. 7. 1, 2, 3, 4, number 5. 6, 7, 8, 9, 10. Okay. Okay. So, right on the dimples, feet, are your feet touching?
Yeah.
Okay, feet together, open and close the knees. Open wide, close, open, slide forward some more. Okay, open, close. Open, close, there you go. Open, keep doing it, please, keep doing it. Right side only. See how the whole thing wants to shift? Yes? Good. Left side only? Left side only. Doesn't go as much,
Yeah.
right? So it's the left that's fixated. That's why when she does the right, it all wants to go with it. Okay? Sacrum. Come back slowly towards me. All the way back. Good. That's sacrum. That's L5. Tender, more tender there or there?
There.
Bottom one?
Mm-hmm.
Top one? Bottom. Top.
Bottom.
Okay. Now let's check the left SI joint. Let me do the work, please. You good?
Mm-hmm.
Okay. So as we're doing this, this is the top of the joint. We're feeling for the fixation. Middle of the joint. Top, middle, bottom. If it's stuck up, then it's going to be more tender on the bottom there. If it's stuck down, it's going to be more tender on the top. So with you, it's here.
Mm-hmm.
Okay? Which is the bottom of the joint. Oh, you're going to have some fun. There you go. Good. So you see, it's tight, but it's moving.
Mm-hmm.
Different from the other
On the
side.
other side, yeah.
Yep. Okay. So we have a sacrum issue. We have a left pelvis issue, which is ASIN gone up and turned in. We have T5. Open the jaw slowly. Open, open, open. Slowly close. So we have a jaw issue as well. Yep. Open, 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 open. So what happens is the jaw issue is on the right side. It's going like this. And then what the body's trying to do is going this way, and then the left side is compensating to bring it back in level. And that we're going to check again after we do the upper cervical adjustment. Okay? Tender there
Mm-hmm.
versus there.
Yeah, on this side.
Yeah. Bend right, bend left. Tender there, but more fixation there. ASR there. That moves better. Okay. And the x-ray shows us ASRA on the right there. The left pelvis has an ASIN. T5 is a PLIT. I'm just talking out loud. So even as she's walking, keep going. So the walk is kind of steppage. That's your normal walk?
Yeah, this is my normal walk.
Okay. Is that her normal walk?
Let me see.
Why don't you come over here so I can show you? Come on this side over here.
Yeah.
So if you look at the walk, just walk like you normally walk. That's how she normally walks? Watch down there.
No.
How do I normally walk?
Just relax. I think
Okay,
you're
hold on.
like just stiff, just
She's
chill.
a-
Let me
Take
tell
Take
you,
a
you're
walking
like,
spot.
yeah, walking spot. That's exactly. Yeah.
Is that her normal walk?
Your steps are too small. Is that how you normally walk?
I feel like that's how I walk.
No, I think you like walk like
I walk
this.
like-
Walk up, go up on your
Like
toes,
this.
please. Go up high on
Yeah.
your toes. There you go.
Yeah.
Okay, walk on your toes like you
Okay.
normally walk. There you go.
Yeah, there we go.
Like
Oh,
this?
okay,
Yeah.
that's your normal walk
Yeah.
now?
Yeah.
Okay, cool. Keep
Yeah,
going.
maybe my steps are a little bigger. Like this.
Yeah. Yeah.
Okay,
So I'll keep doing it.
now slow it down a little bit, please. You can go up on your toes if you want to,
Okay.
but just slow it down a little bit. Okay. So here's what's interesting. She has a left ASIN pelvis, which should cause that left foot flare, but she has a right foot flare. So she's probably sprained this right ankle at some point. We're going to check her ankle. You said left knee,
Mhm.
correct? But I'm also seeing right ankle because of the foot flare. It's flaring out that way. Okay, walk on your heels for me.
Like this?
Yes. See, she veers to that right side. But why I'm saying that is, according to the mechanics on her x-ray, they don't match. We got to go with the patient, though. If we have to choice between x-ray and patient, we go with the patient. Or she's been compensating and she's had this for a long time.
Keep walking on heel?
Yep. Yeah. Now when she does that, you'll notice her left calf is smaller, slightly smaller than her right. Turn around. Watch her below from her knees, and what you can see is that left calf is slightly smaller than the right side. Okay, regular walking.
Regular?
Yeah.
Is it because I put more pressure on something?
It's possible. We're gonna check it out, okay? So I'm gonna do what's called gapping of the knee. I'm looking, what's called valgus varus stress, and relax the knee. I'm just gonna be pushing side to side. If it opens up more on the outside, it's a tibia issue right there. You feel that? If it opens up more on the inside, it's a femur. So yours gaps on the outside and the back here. Okay?
Yeah, I felt that.
Now let's go to this side. Relax it. Let me do it. Relax it. There too. How's this on the medial side here? This more tender, this more tender.
On the inside.
Okay. So, just looking how they sit. This sits somewhat in a normal position. This kind of turns in. She's rolled this ankle also, right? So both things are going on. If I go ahead and push here versus here, which side's more tender there? Bring your feet back. Bring your toes back as far as you can. Bring them back. All the way back. Good. So this side goes back further. This side doesn't. Relax the foot. Relax it. Tender there. Yeah. Okay. Right there. Talus on the medial side. Outside. Inside. Tender more in the center, or just finger pressure?
I think in the center.
That one. It's not here. There's a tiny bit here, but I'm feeling it more
Yeah, I
there.
think right there.
Okay. So this is a straight AS talus. This is an AS talus with a medial tilt. Okay. Now let's go to the naviculars. Finger pressure or sharp?
Finger pressure.
Yeah, if she has to think about it more than a second, it's just finger
Yeah,
pressure. Okay. Check the shoulders. I don't want to move. Let me do the work. It's like a baseball style pitch. You feel that? Does it hurt? Okay. It's just restricted.
Yeah.
Let's do it. Let me do the work. Same thing, right? So this moves more than this. Relax. Let me do the work. There you go. Yeah. We'll test it out after the adjustment. And down. C2. PLS. Nice and easy there. Good. That was a great miss. Drop it down, down. There you go. Let's go on the orange table. You okay?
Yeah.
Cool. She's like, just do it. There you go. ASR. Ooh, relax there. Now I need to push the shoulder up. Are you okay with that? Is it bothering the chest there? Okay. I'm gonna push it all the way up. Let it go. I got you. Good. There you go.
My
You're
turn.
gonna stand over here.
Okay.
You're gonna just hold lightly like this.
Lightly?
The feet may do that. Just catch them. Don't push. Okay? Okay. Slide up first. I'm here.
What do I do with my hands?
You just relax them. I'm going to stabilize the right side. Bottom, the left is going to go that way, okay? Slide up a little more, please. Right side is stable, left side is down and out like this. How's she doing over there?
Just good.
Just like that, okay? Good. There you go. When was the last time you got adjusted?
Me?
You.
Never. That's why I think.
Interesting.
And I've never really cracked my neck either.
Walk this way. You haven't cracked your neck before, right?
No, ever.
That's good.
Okay. I've never able to.
She's walking different. What's different?
This kind of feels something here.
Back over here, let's run the meter, let's continue. And we need to talk about some nutrition. Are you vegan?
Yeah.
Okay, how long have you been vegan?
I've been vegetarian for like a year and a half, and then vegan maybe like the last 6 months.
You?
7 months.
Both of you together?
No, I'm not vegan.
I tried.
What about her? What about you?
Not vegan.
What? Okay.
Mhm.
Neck is clear.
Yes. Home run.
Wasn't a home run, it was a triple.
It's a trick.
Now we're gonna do T5. Good. Cool. Okay, right side only. Better? Still there? But
Yeah,
better.
it's better, yeah. It's
Left
not
side
as-
only. Does that feel different when you're opening and closing the hip?
This one, yeah.
Yeah. Right side
A
only?
little more.
Right side? Yeah. All good. 1, 2, 3, 4, 5. Drop the hands. Nice. That's a home run. Now, remember when we were looking at this, we said tibia? Which one is more tender now?
The right?
So front, the left side we're going to set as an ASIN on the femur. The right side we're setting as a posterior tibia. Hold on, okay? Nice and easy. We're going to set it back like this. I need you to hold on.
Okay.
Good. There you go.
Like right there?
Yeah.
Yeah, I feel something.
Yeah, that's a
there.
rib head.
What?
Okay, rib head. The rib is out. So the rib adjustment's going to happen on full expiration. Take a deep breath in. Right there. You feel that? Yeah.
Oh my God.
Deep breath in, blow it out fast. Blow it out fast. There you go.
Oh, yeah.
Go
That was
on.
exactly where it hurts all the time.
Wow.
That was a rib head.
I thought it was a knot.
It's not a knot.
I swear.
So the reason we get knots, the reason we get these tight spots and knots in the body is due to the muscles guarding that area. There's instability or there's a mechanical issue. And the way I like to explain it is if it's, think of like a pulley system at the gym, right? Pulley system at the gym, if the pulley is off, that cable is really tight. If the pulley is off, the cable can also be really loose.
Yeah.
So mechanically, when things are off in the body, the muscles are going to start getting tight, right? They're going to spasm first, which I'm sure you've had, a spasm. Then it eventually gets tight. And that morning, you wake up in the morning, those areas become very stiff. You get on with the day, you're okay.
Right.
End of the day, it's tight again.
Right.
Wake up in the morning, it's like that cycle. That's also the ligament or the fascia. That's cool. We'll walk it different now. Deep breath.
I'm walking better.
Good.
Feels better.
What's different now?
More open.
Relax there. Let's set the shoulder. There you go. So your shoulders are also coming from your spine.
Oh, really?
Yeah. It's like this. There you go. Nice. First work on that scar tissue and swelling in the ankle. And we said we're going to work on this medial side here. You feel that, yes?
Yes.
Okay, so I'm going to work this out when I'm ready to set it.
I feel like all the way up here, right?
When I push that.
Yeah.
Deep breath. you're gonna do is when I count to 3, you're gonna lift. I don't want you to pull.
How high?
I'll get to her right about here.
Okay.
Okay. Lift. There you go.
Ooh, that felt good.
Mm-hmm.
Now come around or?
Yep. Let's do this side now. 5, 4, 3, 2, 1. Okay. 1, 2, lift. Nice. Let's do tibia. Posterior fib. Posterior fib. Turn to your right side. Bend the knee. Calcaneus. Navicular. She wears heels?
Sometimes, yeah.
Because it hurts or just that's not it?
No, just when I go out.
Okay. You'll feel the difference next time you do those.
Oh.
There you go.
Even like when I walk.
It's smoother now.
Yeah.
Because I'm exaggerating, but it was more like this was her walk.
Yeah.
Yeah, I
That is
always
your
noticed I
It
did
was-
walk like
Yeah.
like
It was a little waddle, okay? No
Like
pun
a
intended.
ducky waddle. Like
Yeah.
It was a, come over here.
here.
Squeeze my hand. Squeeze hard. Squeeze hard. Squeeze. Posterior ulna.
Oh.
Distal radius. Lunate. So, squeeze. There you go. Squeeze. Posterior radius. Nice. Distal radius. Lunate. There you go. Squeeze. Squeeze. That's where we're going to start.
Yay.
Okay?
Thank you.
Welcome to the